COVID-19, you ever heard of it? It's kind of been in the news everywhere. You got KC Metro adds nearly 800 COVID-19 cases. Italy surpasses UK for worst COVID. Johnson County reports 9 more COVID deaths. More than 4,000 people hospitalized in LA County. Deadliest place in America. We've all heard of it. And I want to dig deeper into it, and I have been digging deeper into it. I've been looking into a lot of the statistics that are provided by the Missouri Department of Health. They are surprising. So what I did was I said I'm going to take this data and I'm going to find out what the people really, really want to know. And I think it's a simple number. I think it's the survival rate. Let's jump into it. This is December 14th, 2020, collected again by Missouri Department of Health. You can check it out yourself if you go to showmestrong.mo.gov. Basically breaks it down by age, the number of people who have had COVID, the number of people who have died of COVID. So on this data, I'm going to be breaking down by age what the likelihood of you getting COVID and what the likelihood is of you dying of COVID if you get COVID. Okay, so the chances of you getting COVID. Disclaimer, if every single one of these people who got COVID is still able to transmit it, then this is the chance of you getting COVID. But that's not the case. So realistically, these numbers are at least cut in half, right? Because when people get COVID is that they get the antibodies, and once they have the antibodies, they're less likely to transmit it. It's out of my league. It really is. To be frank with you, is that it's out of my league. I think that the number 2 thing that I can bring you is more accurate, is the chance of survival, or the chance of recovery, rather. Basically what I'm saying here is that if somebody tells you that they can give you the chances of getting COVID, they're lying to you, because the data is all over the place. Now, this is the survival rate with those out there with kids, is that 5 to 17. Well, right now, I should point out that 0 to 4, there hasn't been a single 2-year-old, 3-year-old, 4-year-old who has died of COVID. So the survival rate right now is 100%. It may change, but that's just, again, over a period of, I think, 9, 8, somewhere around months of collecting data. For 5 to 17-year-olds, the survival rate is 99.9. If you get COVID, if your child gets COVID, 18 to 24-year-olds, you have a 99.95% chance of recovering. For 25 to 34-year-olds, that again, I want to also reiterate, this is data collected from Missouri Department of Health. This is their data, not mine. I'm just breaking it down into, I guess, more palatable information here. So 35 to 44, the chances of recovery are 99.942%. 45 to 54, 99.781%. 55 to 64, you have a 99.36% recovery rate. 65 to 74, you have a 97.792%. But 75 plus, you have a 93.738% recovery. Now, I also want to point out, CDC came out with these numbers here, that 6% of deaths, COVID-19 was the only cause mentioned. For the deaths with conditions or causes in addition to COVID-19, on average there were 2.9 additional conditions or causes per death. It's basically saying that 6% of the number of people that had died of COVID do not have any underlying conditions. And so what I did was that I implemented that. I put that number into the data, the charts here, to find out what is the likelihood if you don't have any underlying conditions. And again, with 0 to 4, it's right now 0 to 4-year-olds, freaking beasts. 5 to 17-year-olds, I kept that blank too. Survival rate after, if you're healthy, is going to be more than, it's going to be more likely that you survive if you are healthy and you're 5 to 17. 18 to 24, again, that was also, it's already 99.985% recovery. Your chances are pretty good if you're 18 to 24. Let me go ahead and throw that out there. I think that's very safe to say. From ages 25 to 34, if you are have no underlying conditions, then you now have a 99.998588% chance recovery. For 35 to 44-year-olds, your recovery rate, if you have no underlying conditions, is 99.997%. And then 45 to 54 is that If you have no underlying conditions, that you have 99.987% chance of recovery. For 55 to 64-year-olds, if you get COVID, then you have a 99.962% recovery rate. For 65-year-olds to 74-year-olds, you have a 99.868% recovery if you do not have underlying conditions. I don't know if I said that for this one, but I don't really want to get this. I want to be very, very clear whenever I'm talking about these numbers. For 75-plus-year-olds, if you do not have any underlying conditions, and that is going to mean heart failure, obesity, diabetes, Alzheimer's. Did I say that right? Alzheimer's? But those are examples of underlying conditions. And for 75-plus-year-olds, yes, that's a tremendous hop. If you have no underlying conditions, you have a 99.624% recovery rate. Take from this what you would like, and maybe the perspective on this is a little bit different after you see these numbers. If it's not, okay, but if you support what I'm doing here, and if you like me to continue doing this, do what those people do on social media and share the video.